Next thing we're going to do is look at her knees. So we'll just show extension, and then we'll flex it. And you can see this knee is functioning as you would expect. And this knee has some hyperextension, and sometimes it's hard to appreciate what's going on in babies because there's so much fat tissue, so sometimes it's hard to see what's going on bony, but some hyperextension here, probably still some anterior translation of the tibia on the femur, and then when we flex it, we'll see that she's limited in her full flexion, and a lot of that's probably related to the tibia not fully reducing under the femoral condyles. So, a few things that we can do that are gentle to show to the families. The first thing I always start with, and you could even have a baby that's in full hyperextension, but just longitudinal traction, so just pulling on the leg. And we can just go gently and try to get her to relax. And if the baby is uncomfortable, you don't have to make it uncomfortable. You actually want them to relax their muscles. So just some general, just kind of traction on the leg. And then as you get the traction, I'm going to kind of put my thumb down here and just palpate the femoral condyles a little bit. They're right underneath my thumb. And so we could do a little traction. And then as we do traction, we can bend as we maintain the traction. And as she gets more flexion, we want to try to maintain the traction as we bend. So we can come up, and again, she's just trying to go to sleep, so she's not happy with me right now. Maintaining the traction as I bend and stabilizing the femur against that. And you just kind of have to reposition a lot as the babies wiggle and wait for them to relax. And once I get a relaxation and I feel I can maintain the pull on it, I'll try to maintain that traction as I bend. Now, another thing that you can do is oftentimes the tibia is quite a bit subluxated, and you can actually feel the top of the tibial plateau here, and you can kind of get your fingers on it, and you can guide, you can just do some traction while you put your fingers on the tibial plateau and try to get it to come down. Sometimes what I'll do is get my thumbs here on top. That way I can get kind of on top of the tibial plateau. I can then, these fingers are supporting the femur underneath, and I can pull down on the top of the tibial plateau, and I'm still tractioning while I'm trying to get the tibia to go past the femoral condyles as I flex. And just kind of like a reverse drawer maneuver. A typical kind of ACL drawer maneuver is you're pulling the tibia in front to test an ACL stability. What we're doing instead is we're just adding a little traction, and then we're doing a posterior kind of drawer maneuver as we go into flexion. And sometimes like my fingers slip and I'll just kind of reposition and try to pull. And it's a flexion, pulling down on the condyle, down on the tibial plateau, and then maintaining traction and a little posterior drawer at the same time. So kind of your hand position is your fingers can be like this. Your thumbs are on the top of the tibial plateaus, and you're pulling down first, kind of from the top of the tibial plateau, and then going kind of like a down and under. And at the same time, my wrists are tilting up to put pressure on the femur up here. So thumbs are controlling the tibia as I pull down, and then as I rock, and I'm pulling the tibia towards me and then down into kind of a posterior drawer maneuver. So when I get here, I'm here, coming up on top of the tibial plateau, and your thumbs usually sink in pretty well and get on top, and then I can pull, so I can just do some straight traction here, and I have to kind of get my grip. And then just slowly, as I go down into flexion, I'm trying to maintain that pull and keep pressure on the tibia to go posterior to try to get it to drop down. And she's actually clicking a lot, which is good. That's telling me that she's getting a little reduction there. Okay? All right. She's nice and calm. And you can almost do it like a massage where the thumbs are kind of trying to lock in just on top of the tibial plateau here. They go right into these nice little divots, and I can do it, just provide some traction through my thumbs. I'm actually pulling a little bit too, and as I kind of lose my grip, I kind of come down with, I walk my thumbs back up, and it can kind of become a massage. It can be very relaxing for the infant. And that's what we want. We want her to be relaxed for this to help. If she fires a little bit there, what you don't want to do is just take your hands off immediately, because that'll kind of become like a behavioral cycle that, you know, they'll stop doing this to me.
Yeah.
So we'll just kind of wait for her to relax. And just starting there, that can be a good way for family members to feel like they're doing something about it, you know, being part of the process. And it can be kind of more of a massage kind of type motion, a baby massage, so to speak, but with the anatomy in mind of trying to get the knee to reduce. And then just as she relaxes, we can try to get just a little more flexion as we go. And we can kind of see her patellas right here. And her tibia is kind of right underneath my thumbs right there. Again, just kind of walking my thumbs up, just giving a little traction, trying to get the tibial plateau to drop down below the femoral condyle.